Endometrial cancer is cancer that originates within the endometrium, or the inner lining of the uterus. Out of all of the cancers that we will cover today, endometrial cancer is the most common type of gynecological cancer. There are also many different types of endometrial cancer, but we will specifically mention adenocarcinoma because that is the most common. And adenocarcinoma originates within glandular tissue, so within the glands of the uterus. Going into the classifications or the staging of endometrial cancer, there is type 1 and type 2. Type 1 is estrogen dependent, and then type 2 is not, which does tend to be more of the aggressive type. Prolonged exposure to estrogen definitely puts you at an increased risk for type 1 endometrial cancer, and this could be starting your menses before 14 years of age, or even starting menopause after 46 and a half years old. And I thought it was really compelling to learn that 75% of endometrial cancer patients were postmenopausal, having had started menopause very close or even after this age. And oral contraceptive use is also a very well-known risk factor for endometrial cancer. The clinically relevant diseases would be having another type of gynecological cancer, such as ovarian or cervical cancer. It could also be having PCOS, breast cancer, or endometrial hyperplasia. And the tamoxifen use that also puts you at an increased risk.
Okay, so we're going to go over some signs and symptoms of endometrial cancer. Vaginal bleeding. Now, vaginal bleeding is only before menopause, it's in between periods. And then after menopause, it's going to be more spotting. You can have lower abdominal pain as well as pelvic pain. You can have thin white or clear discharge. Now, this is only if you are postmenopausal. And you can have extremely prolonged, heavy, or frequent vaginal bleeding. Now, this is only if you are over the age of 40. Now, diagnostics. They may want to get a family history on you. They just want to make sure that you don't have any genetic disorders or anything that you inherited that could increase your risk of cancer, as well as they'll perform a physical and a pelvic exam. Now, finding anything along there, they'll move to a CT, MRI, and a transvaginal ultrasound. And then they would move to an endometrial biopsy or a hysterectomy or a DNC, which is a little more invasive and would require an operating room. Now, for treatment management wise, you're going to want to do chemotherapy and radiation, as well as some hormone therapy where they inject hormones or block hormones to help treat the cancer. They'll give you immunotherapy, which is basically just boosting your immune system to help fight the cancer, as well as targeted therapy, which targets specific cancer cells to stop them from multiplying.
Hi, my name is Marissa, and I will be talking to you about cervical cancer. Cervical cancer is a type of cancer that is located in the cervix. It's the lower part of the uterus that connects to the vagina. It typically develops slowly over time, starting with precancerous changes in the cervical cells. These changes can be identified through regular cancer screening tests, such as Pap smears and HPV tests, which can help detect the cancer when it's early and most treatable. There's a lot of risk factors for developing cervical cancer, and some of these include smoking, having a weakened immune system, long-term use of birth control pills, or having multiple full-term pregnancies. And then there are 4 stages of cervical cancer. Stage 1, the cancer is just limited to the cervix. And in stage 2, the cancer has spread beyond the cervix to nearby tissues on top of the vagina. And then in stage 3, the cancer has spread to the pelvic sidewall, which causes swelling and then blocks the flow of urine. And then stage 4, it's advanced cancer and it spreads to organs nearby. Most cervical cancer is caused by a virus called HPV, also known as the human papillomavirus, and it's typically spread through sexual contact with someone else who has the virus. Vaccines are ready and available to help protect against any types of HPV that can cause this cancer. And the HPV vaccine is typically recommended for preteens 11 to 12 years old, but can also be given as early as the age of 9. And the vaccine is usually given in a series of 2 to 3 shots over several months, depending on whatever age you start the series. Some common symptoms of cervical cancer include abnormal vaginal bleeding, such as bleeding in between periods or bleeding after menopause. Women may also experience some unusual discharge that can be watery, bloody, or foul-smelling. And then pelvic pain during intercourse is also a warning sign. When cervical cancer happens, it's often first treated with surgery to remove the cancer, or something called a radical hysterectomy that removes the uterus, the cervix, and then the tissue around the cervix. There's also other treatments such as chemotherapy, targeted therapy medicines, or radiation therapy.
Hi, I'm Bree, and I'll be discussing ovarian cancer. Ovarian cancer is an abnormal growth of cells that start in the ovaries, which are the female reproductive glands that produce hormones like estrogen, progesterone, and eggs for reproduction. The cells can sometimes spread to other areas like the fallopian tubes, the bladder, the uterus, and the staging is determined by how far the cancer has spread. Epithelial ovarian cancer is the most common type, and it starts in the cells that cover the outer surface of the ovary. Early stages of ovarian cancer can go undetected due to symptoms being so vague. Let's talk risk factors. Having a family history of breast, colon, or ovarian cancer can increase your risk. A personal history of breast cancer, mutation in your BRCA gene, being a woman over the age of 40, having children later in life, medical conditions like endometriosis or ovarian cysts, hormone replacement therapy, infertility treatments, talcum powder, smoking, and obesity can all increase your chances. Things that can reduce your risk are pregnancy, breastfeeding, and the use of oral contraceptives.
Hello, my name is Jayla, and I'll be talking about the symptoms. So as Bree noted, these symptoms can be vague, but they'll be persistent, and most of them are gastrointestinal symptoms. For the diagnostics, they'll be performing a physical assessment, and the most concerning finding is an enlarged and palpable ovary. This is most concerning in postmenopausal patients because the ovary should be decreasing in size. Pelvic exam, pap smear, and pelvic imaging techniques will also be used. And I just wanted to note that there will be 2 abdominal CT scans needed, one with and without contrast, for the screening for metastasis. And for the blood tests, usually they're looking for a CA125 protein. I don't know if it's CA125 or 125. It's a protein, and it'll be present if cancer is detected. Now for treatment, so usually because this form of cancer is found in the later stages, surgery will be the prime treatment course indicated. This will consist of staging, exploring, reducing, and removing the tumor, all of the above, and it's usually a total abdominal hysterectomy that is performed. Chemotherapy will follow, and the usual combination is a platinum and a taxane agent, and I provided the 2 vials there. It is carboplatin and paclitaxel, and this is the most effective. And also liposomal chemotherapy is also given IV, and this is a form of chemotherapy that is basically the medicine is encased in a lipid encasing called the liposome, and it can get to the cancer cells without getting destroyed as quickly by the immune system, and the highest dose can be given. Intraperitoneal chemotherapy is only given if the patient has like an excellent kidney function, and also if there's leftover like cancer cells in the abdomen or peritoneum, and it's also a strong form of chemotherapy. And assigned chemotherapy depends for reoccurrence. It just depends on what the patient has already been provided. I read that they can just give a higher dose of carboplatin, and that will just do the job. But it just depends on what the patient has taken already. Or it just might be a completely different form of chemotherapy.